Welcome. Today, we're diving into the 2026 GMP inspection trends with Dr. S.K. Singh. We'll explore how the focus is shifting from just documentation to building a true quality culture. It's about more than paperwork now. It's about mindset and practice across the board. Let's get started. In 2026, FDA inspections are shifting gears. They're no longer just checking if you have the right documents or if training is logged. Instead, they want to see real control in action, how well your systems actually work. Inspectors focus on data integrity, how investigations are handled, and how the quality unit oversees everything. They're looking at management's role, the culture you've built, and whether decisions are truly risk-based. It's about sustainable quality, not just ticking boxes. This new mindset demands a deeper, systemic view of pharmaceutical quality. Let's talk about a big shift in how we think about documentation. It's no longer just paperwork. Today, documentation is about data integrity, making sure records tell the true story of what happened. Inspectors want a complete, trustworthy history. A polished summary won't cut it if the underlying data is missing or unreliable. The FDA has made this clear, calling out issues like pre-signed or backdated records. We now follow ALCOA plus principles. Records must be attributable, legible, contemporaneous, original, and accurate, plus complete, consistent, enduring, and available. Common risks include backdated entries, missing raw data, and inconsistent timestamps. Data integrity isn't just an IT issue anymore. It's a management and culture challenge that touches every level of an organization. The EMA makes it clear. Senior leaders must take responsibility and get involved. When data integrity failures happen, it's rarely one thing. It could be production pressure, weak supervision, or poor system design. Maybe resources are stretched too thin, or procedures aren't strong enough. Fear of reporting problems and inadequate management review also play a role. Regulators now dig deep, looking at audit trails, user access, deleted records, and even how raw data is handled. It's about the whole system and how quality decisions are made. In 2026, the FDA made it clear, treating data integrity failures as just procedural slip-ups isn't enough. They want to see the bigger picture, the whole quality culture and the strength of the quality unit. The old way of closing CAPAs with quick fixes like retraining or SOP tweaks doesn't cut it anymore. Instead, effective CAPAs dig deep, from containment to root cause, then systemic cause, followed by corrective and preventive actions, and finally, a real check on effectiveness. Inspectors are asking tough questions now. Did you find the real problem? Was it caught early? Could it be happening elsewhere? Did you look wide enough? Did you assess product impact? Did you review past CAPAs? And most importantly, did you prove the fix actually worked? Today, we're looking at how quality culture is becoming a key focus in inspections. Weak quality culture shows up in phrases like, "We always do it this way," or "just correct the record." These warning signs point to shortcuts and silence. But a strong quality culture is different. It's about speaking up, reporting issues, investigating, learning, and improving. Management plays a big role here, providing leadership, resources, and accountability. Inspectors will want to see if employees feel safe to report mistakes, understand their roles, and follow procedures even under pressure. Let's talk about risk-based and science-based inspection, a trend that's reshaping how we approach quality in pharmaceuticals. Not all risks carry the same weight, but every critical risk needs to be fully understood. The ICH-Q9 framework guides us in applying risk management throughout the product lifecycle. Inspectors will scrutinize everything from risk assessments and methodologies like FMEA or HACCP, to critical process parameters and contamination risks. A strong risk assessment clearly connects hazards to causes, impacts, controls, and ongoing monitoring, leaving no stone unturned. Let's look at a recent example that highlights a growing trend in API inspections. In July 2026, the FDA issued a warning letter to an Indian API manufacturer for issues like unreported HPLC injections and insufficient electronic data review. This reflects a broader focus on process control and analytical data integrity. Inspectors are zeroing in on every step, from raw materials, through process parameters and testing, all the way to batch release. Key areas getting extra attention include supplier qualification, impurity control, data integrity, and traceability. This means API GMP is under more scrutiny than ever. Trend number 7 highlights a shift in how regulators view validation and qualification. It's no longer enough to qualify something once and assume it's controlled forever. Instead, they expect a full lifecycle approach, from design all the way through to ongoing monitoring and reassessment. Inspectors will dig into everything from user requirements and design controls to process validation, cleaning, maintenance, and even change control. This mindset ensures quality and compliance are maintained throughout the entire life of equipment and systems. Here's the golden rule we're focusing on. If the site is truly in control every day, inspection readiness becomes a natural outcome, not a last-minute scramble or special project. Trend number 8 shows us that inspection readiness means everyday readiness. It's about maintaining control over your facility, your people, your documents, your data, and your quality system. Before an inspector arrives, ask yourself, are equipment and maintenance up to date? Can employees confidently explain their roles and procedures? Are documents complete and accessible? Is data consistent and secure? And is the quality system actively managing issues? This mindset turns readiness into routine. Let's walk through the new formula for quality in GMP inspections. It starts with documentation, recording exactly what happened. Then, protecting data, making sure it's complete, accurate, and reliable. Next, controlling systems with risk-based, scientific measures. We need to investigate effectively, digging deep for root causes, not just easy answers. Verifying CAPA effectiveness shows a sustainable improvement. Building a quality culture means everyone owns quality. And finally, leadership from the top is essential. Management must provide the resources, oversight, and accountability to make it all work. We've reached the end of our 2026 GMP Inspection Trends presentation. If you found it useful, please give it a like. We'd also love to hear from you. Share what GMP trends you're noticing during inspections. Don't forget to share this with your colleagues in QA, QC, production, engineering, and regulatory. And if you want to stay updated, follow and subscribe to the Siphacos channel. Together, we're building regulatory awareness, strengthening quality systems, and protecting patient safety. That brings us to the end. If you need any further support, please don't hesitate to reach out. Thank you for your time and attention. It's been a pleasure sharing this with you.